Go for it.
Hi, I'm Laura Sweatt with Baptist Hospitals of Southeast Texas. I am the Assistant Director of Education, and I'm
Here interviewing for a certification roundtable in nursing management, N5340. Laura, we'd like to ask you some questions about the certification process and some of your opinions as well. The first question I'd like to ask you are, what are the values and benefits of nursing certification?
Nursing certification does a lot of things in moving nurses forward, because basic preparation gives a general nursing basis, and nursing certification or specialty certification allows a nurse to demonstrate that they have acquired the specialty skills and knowledge base relevant to that specialty area.
Okay. And do you think that nursing certification has anything to do with career advancement?
I think that nursing certification plays a very vital role in career advancement. It allows a nurse to set themselves apart from the rest, from a general staff RN role, by having a specialty certification specific to the population that they are caring for. And it's incorporated in a lot of facilities, shared governance, or clinical advancement programs. So certification allows a bedside nurse or direct patient care nurse the ability to achieve a milestone in professional development without having to leave the bedside.
Okay. And from your past personal experience, do you think that certified nurses are treated any differently by their coworkers compared to nurses that are not certified?
I think that certified nurses do receive a certain level of respect and recognition for that accomplishment, because it is an accomplishment that goes above and beyond the basic preparation. So I do think that they are treated sorry, my throat just got I do think that they are treated rightfully so, with a certain measure of respect that is deserving of that specialty certification or that higher stature of knowledge and performance.
And does your hospital offer any kind of recognition or benefits from getting certifications?
Our hospital does. We participate in a program called Success Pays through the ANCC, where our staff nurses, once they meet eligibility criteria, can attain a specialty certification through the ANCC without having any out-of-pocket costs up front. We also have specialty certification built into our clinical ladder program.
Okay. And do you think that certification should be mandatory? If so, why or why not?
I think that specialty certification should be highly encouraged. I don't know about mandatory, because if you make it mandatory, then where are general nurses or beginning nurses going to be able to go? Because specialty certification is not something that you can attain within necessarily 1 year of practice. So the most specialty certifications require that you have at least a year experience in that specialty area. And so I think that it should be highly encouraged, though, because the research does demonstrate that patients who receive care from nurses who have their baccalaureate degree and specialty certification have much better outcomes, because the knowledge base is higher. So critical thinking is better. Their ability to see the whole picture as it relates to that specialty certification and population is improved.
Okay. And what do you think are barriers to getting a certification for nurses?
I think the most common barrier for certification is fear of testing and cost, because most specialty certifications can cost anywhere from $300 to $500. So facilities that have a means for staff to be able to get that specialty certification without having the out-of-pocket cost eliminates one of the big barriers. However, those facilities still have struggle in getting nurses to apply and pursue specialty certification. So I don't think that cost is the true barrier. I think that cost is an excuse that many employees use, but I don't think that that is the true barrier. I think that fear of testing is the real barrier, or the potential to be perceived as not good enough. You know, if you don't pass, nurses are very perfectionistic by nature, and we don't want to be perceived as not knowing what we're doing. So I think that that is the true barrier as opposed to cost.
Okay, and with that being said, do you think that they should be maybe free or at least lower cost for these certifications?
Well, I think a lot of facilities have implemented processes that will allow a nurse to get specialty certification without having any out-of-pocket upfront cost or reimbursing them through tuition reimbursement programs. So a lot of nurses are able to get specialty certification without having that out-of-pocket cost, which again is why I tend to lean towards that not being the true barrier. The true barrier being that I may look like I am not as proficient, and sometimes avoiding that potential allows us to stall our professional development as opposed to pursuing it aggressively.
Okay, and do you believe that nurse certification exams demonstrate a nurse's knowledge and skills?
I do think that specialty certifications demonstrate the nurse's ability or mastery of a specific content. I am board certified as a professional nurse development, and because that's what I do in education, that test is very specific, or that certification testing template is very specific to things that I do in my everyday job and role. I've also sat for a certification exam many years ago for PCCN, and I do think that they do a very good job of illustrating a nurse's mastery of the didactic and knowledge. But there's always some gap between knowledge and skill, so I would not be as bold as to say that every specialty certified nurse possesses a higher skill set. But the majority of them are, because they have a better mastery of the knowledge. And of course, knowledge is the basis required. It's a prerequisite for developing those advanced skills, is having that advanced knowledge and critical thinking.
Okay. And is there anything else you'd like to say about certification, or any other words of wisdom you could give nurses that are maybe interested in pursuing certification? Any kind of information?
I would just highly encourage it. It is a very satisfying accomplishment. It makes you very much so more esteemed by your colleagues. It is very good to have in your professional development resume or curriculum vitae. It's very well worth it. And it helps to close the gap on a lot of those critical thinking processes that may or may not recognize as being a problem or an opportunity for growth, not necessarily a problem. But going through the process of preparing for a specialty certification exam and passing that exam definitely does a lot for self-value, self-esteem, and recognition.
All right. Well, thank you so much for doing this interview with us today, and for our class. I think that they could gain lots of knowledge from you.
Thank you.